Hi everyone, just checking in on a patient story for today. It's Friday, and I did have a patient ask me a question about why I would recommend the gastric bypass over the gastric sleeve. And there's a few reasons, and of course I will get to this more in upcoming videos, but I just wanted to do just a quick little chat about it. But the reason why we would recommend, actually there's just a few reasons why we would recommend gastric bypass over the gastric sleeve. If a patient has really poorly controlled diabetes, we're going to recommend the gastric bypass. And the reason for this is because a lot of the incretin hormones, so like the endocrine hormones, the anti-diabetes hormones are affected more with the gastric bypass than they are with the sleeve. So when patients get the gastric bypass, they often will have resolution of their diabetes as soon as they get the actual gastric bypass. Before they even lose any weight, they have resolution of their diabetes. They're off their insulin. Their blood sugars are automatically better. And that happens because there's increases in GLP. And GLP is basically like what you hear about now with Ozempic, Wegovy, Mounjaro. All of those are GLP agonists, which mean that they act like the GLP hormone. And so they help with the blood sugars, they help increase insulin and help to resolve the diabetes. So that would be one reason. And then the second reason is if a patient, or actually there's three main ones. So then the second one is if a patient has really severe heartburn, there are thoughts that because when you're doing the gastric sleeve, the stomach is made basically into like a sleeve, like a banana. So there's a lot of increased pressure on the esophagus, which can then make heartburn worse because the food is then kind of backed up into the esophagus and can make the heartburn worse. So that would be a reason why we would choose to do, another reason why we would choose to do the gastric bypass. And whenever we're talking about the gastric bypass, or when we're talking about heartburn, I go by both symptoms and imaging. So symptoms could be very severe with the heartburn, but the imaging may show no heartburn. So you have to kind of do both. Or the imaging may show really severe, like grade 3 esophageal reflux, but then the patient might not have any symptoms. And there's a lot of damage that's being done to the esophagus. If there's uncontrolled acid to the esophagus, it can actually predispose to esophageal cancer, which is something called Barrett's esophagus, which is just like a precancerous condition of the esophagus. So we want to make sure that in those patients, we're going to recommend the gastric bypass. And then the third reason is in a patient with like a transplant, like a kidney transplant. Even though there isn't a lot of malabsorption with the gastric bypass, like the old gastric bypasses, when more of the limb was bypassed, then that would be a reason why patients would have to have would shy away from having the gastric bypass because of all the malabsorption. But it's not like that anymore. So there's really not a lot of malabsorption with the gastric bypass, but because the transplant meds are so important, they have to be, absorbed at a certain time. That would be a reason to then do the sleeve on like a kidney transplant patient. You would do the sleeve either before or after the kidney transplant, and that is kind of preferred over the gastric bypass. So that was just a quick little video. I'm actually holding my phone in my hand, and it's been 4 minutes. So I didn't think this video would be that long, but I kind of just thought of it because my patient was asking me. So I thought I would just film a quick one. But I will post it as a video, so I guess it's not that quick. It's like 4 minutes. All right, see you in my next one, and that was the question for the week, and see you in my next video. Please subscribe, and definitely, if you have any questions, all the questions that I get asked are great. I love when patients ask questions. They always apologize. They're like, I'm asking you too many questions, but I love it because, I want them to get the most out of their visit. So hopefully you do as well, and see you next time. Thanks.